Hi, I'm Logan, and this is Imagining New Futures Beyond Predictive Systems in Child Welfare. In this work, we focus on machine learning risk assessment algorithms that are increasingly being used in the child welfare system. We held workshops with parents and frontline workers to ask them what they thought about these algorithms. In general, our participants opposed predictive algorithms and called for researchers to move beyond them and look for new ways to support impacted communities. A typical child welfare case starts with a report to a CPS agency. Then a hotline worker decides whether to investigate the family or not. Then a caseworker investigates the family and decides if there's evidence of abuse. If there is, then they usually place the child in foster care or keep the family together and offer services. Currently, predictive algorithms are used for screening, investigation, and giving services. Algorithms are trained on government records like demographics and past child welfare history, and they predict some proxy for child abuse or neglect. Currently, no algorithms fully automate decisions, they just give a risk score to a worker who makes the decision. Within the last few years, these algorithms have been adopted across the country, and many more agencies are considering using them in the future. In our study, we conducted 7 design workshops wherein we first provided some background on these algorithms, asked participants what they think about them, and then asked participants how they would change these algorithms or the child welfare system more broadly. We had 35 total participants, mostly parents and caseworkers. Most of our participants were Black and or Latino women. Now our results. Most participants said that CPS agencies punish families instead of supporting them. Participants worried that predictive algorithms would make this worse, expanding surveillance and punishment, especially for Black families. But our participants didn't just criticize these algorithms. They suggested low-tech alternatives that could better address many of the problems that these algorithms are supposed to solve, like inaccurate decisions, racial disparities, and high caseloads. Participants said that better hiring, training, and working conditions might help workers make better decisions. They proposed giving money directly to families instead of spending it on algorithms, and they suggested changing laws and policies to mitigate systemic disparities. Participants said that if algorithms continue to be used, then they need more guidelines to reduce harms, like laws to restrict government algorithm use, regular evaluation, and community control of algorithms. Notably, participants didn't suggest trustworthy AI tactics like transparency, explainability, or fairness. Focusing on trustworthiness may not help here because participants don't really trust the CPS agencies that are using these algorithms at all. Instead, we suggest a framework of harm reduction. Finally, participants suggested new ways that researchers use data to support families beyond making algorithms for CPS agencies, like using data to help families fight CPS cases, evaluating how harmful the system is, and making an algorithm to tell mandated reporters when not to report a family. Finally, some implications. Many participants opposed predictive algorithms in child welfare and suggested low-tech alternatives instead. As researchers, we should not only advocate not to design harmful technologies, but we should also redirect our energy and money towards non-technical solutions as well. Second, prior participatory work in child welfare and in public algorithms more broadly has collaborated with government agencies and tried to facilitate positive relationships between communities and governments. But this excludes many people like our participants who've been harmed by these government agencies and don't want to stay positive. Instead, our participants suggested that we researchers work in solidarity with impacted communities, even to oppose child welfare agencies. Thank you for listening.